Hi everyone, Dr. Hall here, and we've just done the posterior aspect of the scapular region, and we're about to do the anterior aspect. So before we move on, a quick review of the structures we've already done. Deltoid muscle, which is being supplied by the posterior circumflex artery and the axillary nerve coming through the quadrangular space. Triceps brachii with its long head interrupting the teres major and teres minor. Teres major attaches to the anterior surface of the humerus. Radial nerve visible between these two heads of the triceps muscle. Teres minor and infraspinatus in cahoots with each other because they are lateral or external rotators of the humerus. Supraspinatus muscle here attaching superolaterally on the humerus. Abductor along with the deltoid muscle. So let's see if we can flip this around and do the anterior surface. Oh, wish me luck. Kind of a disaster. Okay, so here is our teres major muscle attaching to the anterior surface of the humerus right here. So that will be pulling that way. We also have a muscle on the anterior surface of the humerus, which is actually deep to everything else, right? Because the posterior ribs are here. So superficial is that way, backwards, down. And so this surface is deeper. And so we'll find a muscle that attaches to almost the entire anterior surface of the scapula. We would have the coracoid process coming out here and then inserting onto the anterior humerus. So this is the subscapularis muscle, and of course if this shortens, because it comes all the way out here, it will medially or internally rotate the humerus along with the teres major. This was our radial nerve and our axillary nerve, both coming off of our posterior cord. Now, there's actually another muscle that attaches to the scapula anteriorly, and it's one that you probably haven't thought about for a long time, way back from the first unit in class. So I'm going to show it to you and we'll see if you can figure it out. So it has a broad attachment to the most medial border of the scapula, so anteriorly on the medial border. Remember, on the medial border posteriorly we have the rhomboid muscles, and then it curves around over the rib cage and inserts in multiple different places. So maybe you'd see those jiggity jaggedy edges and you remember this is the serratus anterior muscle. So we would have that long thoracic nerve coming down the surface of it, and this muscle is going to hold the scapula, stabilize it against that posterior rib cage. So let's review. We've got our serratus anterior muscle here, subscapularis. Let's try for a flip again. Whoops, a few things fell apart. So supraspinatus, infraspinatus, teres minor, teres major attaching to the anterior humerus. We have the posterior circumflex humeral artery and axillary nerve coming out through that quadrangular space, bordered by the teres minor, teres major humerus, and long head of the triceps. And then down here in our triangular space in between the heads of the humerus, we'll see the radial nerve as it's spiraling around the posterior humerus. So that's it for the scapular region.